Hello friends. Friends, do you know when the first IVF baby was born? Well, the first IVF baby was born on 25th July 1978 to Lesley Brown and Gilbert John Brown in England. Since then, around 8 million babies have been born worldwide, and every year around 2.5 million cycles are performed. So IVF has actually come as a boon to the infertile couples. So friends, what is IVF? So IVF is a procedure where we take out the eggs from the woman's ovaries, mix it with the sperm of the husband, make the embryos and keep it back inside the uterus of the woman. So how IVF is done? So here we start the cycle from day 2, day 3 of the menses, where we give daily injections to the patients for the eggs to develop in the ovaries. So this process goes on for say around 10 to 12 days, and once the eggs are ready, the ovum pickup procedure is done, where we put the probe through the vagina, put the suction and we take out the eggs. Then we mix the eggs with the husband's sperm in the lab, we make the embryos and we freeze the embryos. In the subsequent cycle, we prepare the endometrium of the patient, and then we do the embryo transfer, where we put the embryos back inside the uterus of the woman. So as simple as that. So friends, why IVF? So why some of the patients need IVF to conceive? So for any pregnancy to happen, there are four prerequisites. First, we need a good quality egg, a normal tubes, normal uterus and good quality sperms. So if there is defect in any one of these, then the patient may have difficulty in conceiving. So the first indication of IVF is the tubes. So the patient may be having blocked tubes. So because of any past infection, the tubes may be blocked, any tubercular infection, the tube may be blocked, or the patient may not be having tubes sometimes due to some previous surgery where she has undergone self-injectomy for say ectopic pregnancy, or she has done some tubectomy. Sometimes the tubo-ovarian relationship is altered because of endometriosis or previous some PID. So in all these cases, we have to go ahead with IVF. Now the second indication is, so if there is any problem with the egg quality, then also we have to go ahead with IVF. So like in PCOS, this is one indication where we in PCOS patients, the eggs are not forming on time. So first we give medicines to the patients to conceive. If they are not conceiving with only medicines, we can go ahead with IUI. If after 3 cycles of IUI also the patient is not conceiving, then we may have to go ahead with IVF. The other indication is, suppose the quality and the quantity of the eggs have come down due to say some previous endometrioma, endometriosis or some genetic factor, so or lifestyle also. So because of all this, sometimes the egg quality comes down. So in these cases also, if the egg quality is poor, then also we have to resort to IVF. Now the egg reserve may be less. Suppose the patient's age is more than say 35 to 40 years and the egg quality and number has come down. In these patients also we have to go ahead with IVF. Now sometimes it so happens that the patient egg quality is very poor, and then we may also have to do IVF with a donor egg, where we take the egg from the donor, we mix with the husband's sperm, make the embryo and keep inside the uterus of the woman. There may be other reason also, like there may be problem with the uterus. Suppose the patient is not having a uterus, absent uterus because of some previous surgery like hysterectomy, or sometimes genetically by birth also the patients are not having a uterus, or suppose in the uterus there are big fibroids or big adenomyosis and the patient cannot conceive, or the patient is having a very thin endometrium which is not getting cured by medicines, like the thin endometrium may happen due to some chronic tubercular infection or Asherman syndrome. In all these patients, we may have to go ahead with surrogacy. Sometimes the patient is not medically fit to carry a pregnancy, or she is having repeated implantation failure or recurrent pregnancy losses. In these patients also we have to sometimes go ahead with IVF with surrogacy, where we take the egg from the woman, mix with the husband's sperm, make the embryo and keep inside the uterus of a surrogate. So these are the female indications for which we have to go ahead with IVF. Now for pregnancy to happen, we also need a good quality sperm. So if the sperm quality is very poor, then also sometimes we need to go ahead with IVF. So for any normal conception to happen, we need at least 39 million sperm in the ejaculate. But even if the sperm absolute sperm yield is more than 5 million, then we can go ahead with IUI, the intrauterine insemination, where we do the sperm washing and we keep the sperm inside the uterus of the woman. But if the absolute sperm yield is very less, say less than 2 million per ejaculate, then sometimes we have to go ahead with IVF, because in IVF what we do is we are keeping the egg and the sperm side by side in a petri dish, so it becomes easier for the egg to get fertilized. Now sometimes the sperm quality is very less, the number are very less, then we have to go ahead with ICSI, where we inject the sperm directly inside the egg of the woman. Now there are some couple who have no sperm at all in the ejaculate, a condition called aeuspermia. So these patients also, they can conceive with the help of IVF. Here what we do is we put a needle in the testis and we take out the sperms from the testis, and then we do ICSI with these sperms. Now there are other problems also. Sometimes the couple is having some genetic problem. In such cases also where we do IVF, where what we do is we test the embryos before we implant them. So after testing, the normal embryos are implanted back inside the uterus of the woman. Now a very common indication which is coming up is fertility preservation. So fertility preservation, friends, are needed in patients who are having cancer. Now the incidence of cancer is also increasing day by day. So before going ahead with chemotherapy, the woman or the men can preserve their egg and sperm, because after chemotherapy the egg quality and the sperm quality deteriorates. Now another indication for fertility preservation is social delaying of pregnancy. Now nowadays we see that the women don't get married early and don't want to have children early. So in such women, such couples who don't want to have pregnancy in the near future, they can go ahead with the freezing of their egg, and if they are married, freezing of the embryos. Like we know that with age the egg quality keeps on coming down, so such patients we can do the egg freezing. So friends, basically you see that IVF can be done for infertility also, for some genetic disorder, for cancer patients, and also for social freezing. So friends, this is all about IVF, why IVF is done, how it is done. So I hope this video has been useful to you and it must have answered many of your queries. Still, if you have any query, you can WhatsApp me in the given number. Thank you so much.